Have you ever pondered on the prevalence of erectile dysfunction in older men and the importance of finding the right medication? Erectile dysfunction, a condition that affects about half of men aged 40 to 70 to varying degrees, is more common than you might think. With only 1 in 10 men reporting a complete inability to have erections, the question becomes, which drug is the most effective for treating this condition? Let's dive into the world of erectile dysfunction drugs. There are 4 main contenders in this arena: sildenafil, more commonly known as Viagra, avanafil or Stendra, tadalafil or Cialis, and vardenafil or Levitra. Each of these drugs works by improving blood supply to the penis and, in combination with sexual stimulation, can produce an erection sufficient to initiate and complete intercourse. Sildenafil, the first drug your doctor is likely to suggest, has been on the market the longest. Its side effects and interactions with other medications and foods are well known. However, finding the best erectile dysfunction drug for you may not be a matter of biochemistry, but rather a game of navigating health insurance rules. Insurers often limit the number of pills you can obtain per month, and once you hit your limit, the out-of-pocket cost for a single pill can skyrocket. In addition to the 4 main drugs, there's also a fast-dissolving form of Levitra called Staxin, which you place under your tongue. Cialis is the only erectile dysfunction drug approved by the FDA for daily use in a dose of 2.5 or 5 milligrams, which can help produce erections on demand and may also relieve urinary problems resulting from an enlarged prostate. The cost of these erectile dysfunction pills varies considerably, depending on the pharmacy price, prescription copays, and your level of health plan coverage. Even if your private insurance covers it, you may be limited to 4 doses per month. To contain costs, consider shopping around, pill splitting, or exploring manufacturer discount programs. All this said, it's important to note that these drugs are not a one-size-fits-all solution. They produce an erection sufficient for intercourse in about 70% of men, but results can vary greatly from one individual to another. Men with nerves or arteries damaged by prostate surgery, diabetes, or cardiovascular disease may not respond as strongly to these drugs. Finally, the timing of these drugs is an important factor to consider. How soon they start working ranges from 15 to 60 minutes. Viagra and Levitra may not work if taken after a meal, which blocks their absorption. However, Cialis and Stendra do not interact with food in this way. In conclusion, finding the right erectile dysfunction drug involves considering a variety of factors, including effectiveness, side effects, interactions, cost, and timing. It's a personal journey that requires working closely with your doctor to find the best fit for your needs.